Dr. Shireen Lim. She is the author of the book, Breathe, Sleep, Thrive. Discover how airway health can unlock your child's greater health, learning, and potential.
If we're dealing with poor jaw anatomy, how come we aren't growing jaws properly in the first place? Form follows function. And if the jaws grow the most in the first 6 years of life, we need to pay attention to that poor oral dysfunction that actually leads to poor jaw development. That's how I learned about tongue tie and myofunctional therapy and promoting nasal breathing. I understood that breastfeeding, it was really important for good jaw and airway development. And tongue tie was an underlooked issue with that. The number one modifiable factor that can influence mandibular development is breastfeeding. Breastfeeding is nature's pellet expander. The way that the jawbones grow is actually stimulated by the muscles, the way that the muscles are working. And when it comes to the palate or the roof of the mouth, the tongue is very influential. When we have a tongue tie, we can have a lot of dysfunction and no symptoms. We can do compensations, and we can compensate with various other muscles. There's a lot of different patterns that I see.
People might think a tongue tie release is like a means to an end procedure without really grasping that it's to help with an overall goal. It's surrounded by other types of therapy. There are many children who are going to speech therapy and stuck in that therapy for years without making sufficient progress because there might be an undiagnosed tongue tie or myofunctional disorder.
The upper lip tie and the restriction and the impact that this has on the fascial system could be more than I ever imagined. I think we are all born with a genetic potential to grow full jaws. We're introducing pacifiers, which are altering muscle function. We're not breastfeeding as long. There's more formula and bottles. And so all these changes, increased pollution, living indoors, affecting the way that we breathe, they're all changing the way that our muscles are working. What I think we need to promote in the future is to unlock airway health from infancy. And the earliest warning signs of problems are when the muscles aren't working correctly. We actually should pay attention to the way that the mouth is being used. We can compensate and use other muscles, but if we don't use our tongue well, ultimately that'll play out down the track, especially during sleep. The worn teeth is really one of the strongest red flags in the mouth that a child may not be breathing well. It does not make sense anymore to refer to an orthodontist and watchfully wait and take out teeth. Once you see it, it's really hard to unsee it. Airway health is the cornerstone of thriving vitality and well-being, and if we can pay attention to that rather than react so much when we have problems and diseases and medicating and surgery, we can really change the trajectory of many people's lives.